Sunday. I think it's Sunday for most people. I'm very excited to introduce Liseth today, who's talking about a topic that I know many of you might find really useful. I wanted to also let you know that only the speaker series, the presentation is going to be recorded. At the end of the speaker, after Liseth's done talking, there'll be a discussion period, and that won't be recorded, and the Q&A won't be recorded. So it's just where she does her presentation. So Liseth, tell you a little bit about her. She has been kind enough to help lead our caregiver support efforts, and tell you a little bit about her background. For those that don't know me, I'm the Emotional Wellness Director at NDF, and I'm very excited to introduce Liseth today. Liseth Silva is from Ecuador, but has been living in Canada since 2013. And she's been taking care of her husband, Irshaad, who's a GNE Myopathy patient. She's been assisting and taking care of him as his disease progresses. She got her bachelor's degree in family counseling from the Catholic University of Guayaquil, which is in Ecuador. She's also completed levels 1 and 2 training in Gottman Method Couples Therapy. She has a YouTube channel in Spanish language dedicated to marriage, parenting, and personal growth topics. Since 2020, Liseth has also been a volunteer moderator for the GNE Caregiver and Care Partner community page. So I'm very happy to introduce her and look forward to hearing her presentation today. Hi, Liseth.
Hi, Carol, and hi, everyone. My name is Liseth. I'm a GNE Myopathy caregiver for my husband, Irshaad. And I'm very happy to have the chance to share with you about this topic, about how to nurture the relationship between the GNE myopathy patient and their caregiver or care partner. And I would like to start this topic with this quote that says, if you can learn to love yourself and all the flaws, you can love other people so much better, and that makes you so happy. So whether you're a patient or a caregiver or a care partner, we all need love first for ourselves and love for each other. So it's important to remember that we are worthy of being loved, because when we love ourselves, we can accept love from others, especially for those who have decided to take the role of being our caregivers or care partner. So a little bit about my story as a caregiver, for those of you who haven't heard before. I am Liseth. I'm from Ecuador, which is a country in South America. I met my husband Irshaad online on 2008. By 2005, he was already starting to show signs of GNE myopathy, but he wasn't diagnosed in 2008. And by then, he started, we became friends online. By 2011, he was able to come down to marry me in Ecuador. And at that time, as you see in 2011, that's a picture of our marriage at the court. He was able to still walk. He was able to still take care of himself. He would just have occasional falls, and his arms were weak, but he was able to pretty much take care of himself. He required very little assistance. And then as time keep going, the disease starts progressing, and after a fall that he had at some point, maybe 7 or 8 years ago, after that fall he had when walking inside the house, then he broke his arm, and for 6 months he wasn't able to really move much because of the arm that was broken. So he lost his ability to walk by himself from all that time, not being able to do too much movement. And also it was a bit frightening when he would walk by himself and fall. So he depends mostly on me to do a few steps. So eventually he mostly he can move by himself, he can walk by himself, but so when we go out, it's either he's using the wheelchair. By that time in 2018, that's a picture when we went to visit my family in Ecuador. We were able to do that trip. It was our first trip with him not being able to walk by himself, but everything worked out. Recently we went again and everything worked out well. But yeah, the disease keeps progressing. By now there's much more things that he cannot do by himself, so he's requiring more and more care, right? So GNE myopathy can be very challenging, not just for the person who is a patient, but also for whoever decides to be their caregiver or care partner. In this case, also if it's your spouse, you're both dealing with GNE myopathy in one way or another, it becomes part of your relationship. So I do think it's very important, like to work in nurturing your relationship with your care partner or caregiver, whether it's a spouse, whether it's a parent, a sibling, any type of relative, or even a friend, because what has helped us a lot for me and my husband is being there for each other. And when you know that there's somebody there for you who cares for you, who loves you, who appreciates you, who supports you, who brings out the best in you, and also who has seen when you're not doing great, it does make things much better. So that's why after being a caregiver for my husband for so many years, I do think that this is a role that requires love, empathy, a lot of commitment, time, and patience. And it's like this quote says, caregiving often calls us to lean into love we didn't know possible. So, however, I do believe that this role is not for everyone. So whoever decides to take this role, whether it's a spouse, a partner, a relative, or a friend who's caring for a GNE myopathy patient, should be very honest about how much care they can really give. Because what often happens is when caregivers become immersed with the needs of others, they often forget to take into account their own emotional and physical health. And when that happens, that can lead to caregiver burnout, right? Because what happens is that many times as a caregiver, as a care partner, you feel like you're too tired, or you don't have the time, or you're not a priority, the patient is a priority, so you don't take some time for taking care of yourself as well. So you may fall into something that is called caregiver burnout, which is a state of physical, emotional, and mental exhaustion. It may go along with a change in attitude. You know, you start at the beginning being very positive, very caring towards your loved one, and eventually, as the caregiver burnout starts, then you start becoming more negative, and your attitude changes towards the patient. So this can happen when the caregiver is not having like enough help, support, or when they're doing more than they can really do. So some of the signs of caregiver burnout are when the caregiver or care partner starts becoming more angry, more argumentative, and more irritated. He feels more exhausted more often, anxious, maybe even depressed or hopeless, or feels helpless. And they may be also change in appetite and in sleep patterns. Those are the most common signs. So in some cases, when you don't take care of this when it happens, or you don't prevent it from happening, what the caregiver or care partner may even resort to force or verbal or even physical abuse, which is very unfortunate, because there have been cases of patients who are being either verbally abused or physically abused by maybe a spouse that is going through a caregiver burnout. And this is something that, as I said before, it shows that being the caregiver care partner for somebody is not something that is for everybody. Like, the person who is really taking into this role should be very honest about how much they can do. I know there are cases where the partner, for example, or the spouse is very honest and says, like, I cannot do this, like, we're going to have to hire somebody or have somebody else to do it, because they know that they just won't have what it takes to keep that positive attitude, or to have that what is required, that level of commitment into caring for somebody, aside from taking care of themselves. And if they're kids, obviously is even more, much more responsibility. So make sure, like, the caregiver or care partner every so often checks how much they're doing, and if what they're doing is really okay, or if they're doing much more than they can, they should get some sort of help and more support from other relatives that can divide the tasks and take some of that responsibility distributed, so that the care caregiver burnout can be prevented and not get to the point where there is abuse, which is obviously not only, it doesn't only affect the patient, but it also affects their relationship. So this is very important to nurture the relationship because the state or the quality of your relationship between you as a patient and the caregiver care partner affects the way you both are coping with living with GNE myopathy. Because obviously, if you have a good relationship, this has a good effect on your mental well-being, and it promotes positive feelings between each other and makes things much more manageable. On the other hand, if you have a bad relationship with each other, it makes living with GNE myopathy a much more challenging and difficult experience. It promotes negative feelings of anger, resentment, or guilt, or frustration, hopelessness, and helplessness. So what can you both do to have a good relationship? Obviously, you have to nurture it from both ends. So one of the ways you can nurture your relationship is showing appreciation, even for the smallest of things. And my husband, for example, he practiced this very regularly. He will like thank me for things I do for him, even if it's the small things I do every day, like giving him a glass of water, or if I had to wake up to help him to change positions on the bed through the night, like whatever it is, however regularly I do it, or how if it looks it's something like it's just part of our day-to-day routine, he will still show appreciation. He'll make sure that I know that he's not taking it for granted, that he's seeing what I'm doing, and that he really really appreciates that. So, and when you have that appreciation, when you know that the other person is seeing what you're doing, it feels very rewarding, and it helps to nurture that positive feeling between each other. And this is something that should go in both directions. It should not just like be like the patient making sure that they show appreciation for their caregiver care partner. The caregiver care partner can also show appreciation back for whatever thing, however small it may seem, that the patient is doing for them. For example, my husband may not be able to do many things physically by himself. However, he does show care for me when it comes to my mental and emotional well-being. He will ask me, like, this is something that he regularly does. So he checks like how I'm feeling. Like he'll ask me, how are you feeling today? If I'm doing something like some sort of project, or if I'm having some sort of issue, perhaps with other people, like, I don't know, relatives or other friends, he'll ask me like, how did it make you feel? So he's always like very perceptive of how I'm doing, how I'm feeling. So that in that way, he's showing me he cares for me, right? And other example is like when we go out, sometimes he's like, oh, why don't you get this, or why don't you get that, when it comes to like a certain type of drink or a certain type of food that I enjoy. And he will suggest and be very insistent about like me getting it for myself, because in this way, like when I ask him, why are you so insistent about me getting this particular food or this particular drink, and he's like, I feel happy and I feel like this is something for you when you get something that you like and you feel happy about it. I feel like I did this for you by encouraging you to like get it for yourself and to spoil yourself a little bit. So these are like examples of ways that, even if there are no physical ways that you're doing something for your caregiver care partner, you are showing you care. You're showing that whatever you can do still for the other one, you also do it. So appreciation, again, as I say, goes both ways. It doesn't have to be just from the patient to the caregiver care partner for everything they physically do or they help you to do. The caregiver care partner should also show appreciation and notice and point out all the good things they see on each other, right? And another way to do this is by mentioning things that you admire on each other, right? Like it's very important, especially when when your caregiver or care partner is a spouse, but in general, whether it's a friend, whether it's another relative, to mention like every so often, like, wow, I admire how you do this, or I admire your sense of humor, or I admire your how you persevere through this or that. Like mention things you admire every so often, maybe once a week at least, or make it a habit, because that also nurtures your relationship, knowing that the other person sees good things on you and points out the good things. It creates an atmosphere of a positive atmosphere between each other. Another thing you can do is celebrate any good thing, any progress that happened, even if it's a small one, whether it's in any area of your life or in any area of your relationship, because this is also a great way to support each other, right? To show that you care, that you are there present for each other. And this is something very important, to be present. You know, you may be spending a lot of time with each other physically, but you may not be really present with the other person. And it's so important for us as humans. We are sociable beings. We are people that need connections. And unfortunately, nowadays, even though we have technology that allows us to connect to people all around the world, we are very distracted, and we have forgotten to connect with ourselves, with our own body, with our own emotions. And we have like not make it anymore a priority anymore to connect with those who are around us. And that is so important, to be present, you know, to feel that the person is there and that you're not alone, that they're not just there because they have to be there. They are there because one, they want to be there, and they are really, they're present with you. So how do you show that you're present? You can do it by listening without distractions to the other person, whether these are internal distractions, like you're thinking about something else when the other person is talking to you, or avoiding also external distractions like looking at your phone, which is something a lot of people do nowadays. You know, somebody's talking to them, they're looking at their phone, they're looking at the TV, they're looking at the computer, they're looking whatever else. And that's giving the other person a message like, I'm here, but I'm not here for you, really. So you may be spending a lot of time together, but it should be a quality time. It should be a time where you really connect, where you're really there for each other. So to show that you care, to show that you're there, you can also like show interest on what the other person is saying or sharing with you. You know, you can do this by asking questions like, do you want to share more about it? Or I would love to hear more about that. Or how did that make you feel? You know, my husband is very good at this. I'm usually the quiet one in the relationship. I'm much more, I don't talk too much. But my husband has a different personality in that sense. Like, he loves to talk, and he always has very interesting things to talk about. So sometimes in order to like to show interest on what I'm doing, he will just ask me like, how are you feeling today? Or how are you doing today? Or what did you do today? So that way he shows me that he cares. He shows that he's interested in what I do, even if it's your day-to-day routines. Like, it doesn't have to be like something special and huge that you have to share with each other. Even if it's the same thing every day, let's just share with each other. Maybe share how you feel that particular day. Maybe something that was interesting for you that day to share with each other was like something that you just saw. You saw this beautiful bird flying in the sky. Even that, like just being present with each other and learning about each other, it helps you to connect at a more deeper level, even if it's about small things that you do day to day that you're sharing about. So remember to ask questions. Also remember important stuff and about each other, right? If one of you have like, I don't know, an important appointment with a doctor, or in the case of the caregiver care partner, they have maybe something that was going on at their workplace, like ask about it. How did it go? You know, it doesn't have to be only like to remember birthdays and anniversaries. That's important stuff too. But even like things that you know that the other person is worried about or is excited about, like remember also to ask about that. And whenever you're sharing with each other, make sure like you empathize and validate each other's feelings. You know, this is something very important. You may not agree with what the other person is feeling, perhaps about something particular. You may not have reacted the same way to that particular situation, but that's how they feel about something. And our feelings, like the way I feel, the way you feel, is somebody cannot come and just say like, oh, you're being such a baby. Why are you making such a big deal about this? You shouldn't feel sad about this. Or they tell you something different, like if you're feeling sad and you're sharing that you're feeling sad, maybe the other person says like, just smile and everything will go away. it's a good, they have a good intention behind it, but it's much better to acknowledge what the other person is feeling and validate, like, yeah, I see how, if I was in your situation, I would feel the same way, or I see why you will feel frustrated about that, or, you know, just validate each other's feelings instead of criticizing or judging each other's feelings when you share, because when you criticize or tell the other person, you're being such a baby, you're overreacting, if I was in your place, I wouldn't have done it that way. You are making the other person just like not being willing to share more with you, not connect more with you, because you're judging them. They're not feeling safe when they share something with you. And it's so important that you feel safe, not only physically, but emotionally speaking, with the person you're spending most of your time with your caregiver or care partner or the patient. So make sure that you make it also a habit to respect, empathize, and validate how the other person is feeling about something that you may be sharing. Now let's go to the area of communication. Communication is a very important area of any relationship, and certainly it is a very important aspect of the relationship between a patient and a caregiver or care partner. So we can talk, there's so many different techniques to effectively communicate with each other. We could like spend hours just reviewing different techniques, but we're gonna focus today on just one particular technique, and it's a technique that it comes from the Gottman Institute. They have a technique when it comes to like expressing positive needs or complaints in a positive way. You use the formula. The formula is usually I feel when and I need, but we're gonna slightly modify it, and we're gonna start with the when I feel and I need, right? So for the when part, we're gonna describe what is happening. We're not gonna evaluate, we're not gonna judge. We're just going to describe first the situation in a simple way. We're gonna just state the facts in our description, because at this point, we're not yet expressing our feelings or asking for anything from the other person. We're just setting up the conversation by using facts. And why we need to do that first, because the person you're talking to needs to know or needs to understand or be aware of the situation you're about to communicate, which will eventually lead you to the request you have from them. Now for the I feel part, in that part, we're gonna now make statements that start with I instead of you, to avoid blaming the other person, because when we use statements that start with you, we're more likely to end up expressing criticism, especially if that you statement is followed by words like you never or you always. And unfortunately, many times when we try to express to the other person things that make that we need from them, we make them feel like they're being attacked or they're being blamed or they're being judged, and they get defensive because we're telling them things like, for example, you never take me out, or you always react like this. And so the other person, instead of being more open to listening to our requests and the thing we want to express to them, they become defensive. They may like even counterattack by saying something they don't like about us. And then there's no effective communication there. You can't get your message through, and this becomes an argument, and like there's no way to like get what you need or to express what you want from them or from the relationship when this happens. So make sure that you focus on what are you feeling about the situation you just described that is happening. Focus on that. That way the other person doesn't feel blame or attack about what you're saying. And after that, we go to the and I need part, where you're gonna express clearly what you want. Be very specific, very clear about it. Don't be vague. You know, like if you need something, try to give it maybe a time, a date, if necessary. The more specific you are about what you need or want from the other person, the more likely they'll be able to carry it on. Yeah. The more vague you are, it's like you don't really like, you're not really getting them to like understand what exactly you need from them. And when you express clearly what you need from the other person, you're more likely to get the care that you need in the way you want it, instead of then guessing or trying to figure out what you need. Also, always be polite, obviously, when expressing what you need or want from the other person. Use kind words, be polite, and also mention some appreciation in there. That helps to make the other person feel less defensive. You show appreciation about maybe if they were doing something before that you that has to do with your need, and that was something you like, but then for some reason they stop. Mentioning like, oh, remember that time, I appreciate so much when we did this, or we did that, or you did this, and I like us to do this or that, right? So be polite and show appreciation whenever possible. I put an example here, just to give you an idea of how to use it, right? So we're gonna start with the when. So when we're gonna, again, describe the facts, what's happening. When we stay at home and don't go out more than once a month. That's a fact. Nobody can argue about it. This is what's been happening. We're not going out more than once a month, right? We're being very specific. This is what's happening. And then you say, for example, how is this situation making you feel? You say, I feel bored, for example, right? I feel bored, instead of saying like, you never take me out. You don't care about my feelings. You don't care what I do. If it was up to you, we'll be here in the house the whole day and, doing nothing. So that'll produce a defensive response from the other person. Instead, I'm saying like, I feel bored. When we don't go out more than once a month, I feel bored. What you need, what you want about the situation from the other person. I need to go out at least once a week. I'm being very specific. I want to go out at least once a week. So I'm giving even a time, a frequency, right? And then I'm going to show some appreciation for something that was being done in the past related to this need that I have, to make the other person know that I appreciate when it was happening and I would love it to happen again, right? Remember, we had so much fun when we went to the movies last month. And then I'm going to say my need. I would love to go to the movies again this weekend with you and have some dinner after. I'm even reinforcing what I need and being even more and more specific after showing some appreciation towards the person I'm talking to, right? So this way to present a need or even a complaint, instead of saying to the other person, like, we never go out, we're always in the house, I'm so bored, I'm getting depressed because we don't go out, I don't feel good. Instead of saying in that way, you're expressing it in a positive way. You're expressing it in a way that helps the other person to understand what you need, where it's coming from, and what can be done about it. Another important aspect also of any relationship, especially between the patient and the caregiver and care partner, is to learn that we as human beings, we're going to make mistakes. And when we make mistakes, there's something called apologizing, which helps a lot. So don't be afraid to acknowledge when you have said or done something that was wrong or hurtful towards the other person, because we're not perfect. We're going to make mistakes, especially when living with GNE myopathy or any other similar condition. It's not an easy situation. So there are going to be times where the patient and their caregiver may feel both tired or sad or frustrated or overwhelmed or even hopeless. And during those moments, you may say or do things that are not exactly nice to each other. For example, you may overreact to things that normally you wouldn't. So after some minutes of hours or even after some days, when you look back at what happened, you're not feeling angry, frustrated, or irritated anymore. You realize that you made a mistake, that you hurt the other person, but you didn't realize that right away. So even if you're not able to realize right away that you hurt the other person, that what you did was not right, it's still like there's nothing wrong with apologizing even later, or as soon as you realize it, even if it's hours later, days later, months later, even years later, like still acknowledge what happened, acknowledge, maybe even give information about what was happening to you, how you were feeling that day, what was the context, it helps the other person to understand better why you acted the way you did, not to justify it, but to understand what was behind that. Because sometimes you're not angry at each other. Sometimes you're just dealing with so many feelings of at times of grief, of losing certain things that you cannot do anymore as the sickness progresses. So it's totally normal to like be feeling at times like you just can't be too nice to each other. Like it's gonna happen at times. So maybe what you can do in those cases after apologizing and talking about it and understanding what was behind it is to perhaps make a plan to say, okay, when this happens again, when you get angry at me or I get angry at you, or when you're feeling maybe easily frustrated, or what should we do to deal with it in a way that we don't hurt each other, that we don't say things that will damage a relationship, right? Have a plan after, have a conversation about it, and have a plan after to process what happened, and if there's anything you can do also to repair what happened, do it, even if it's something small like giving each other a smile, or sometimes sense of humor helps a lot in some situations, or maybe you want to give something to the other person, or it's just depends of the situation in the relationship, but make attempts to repair if possible. Ask forgiveness, be very sincere, obviously, in this act of asking forgiveness. You don't want to come out like, okay, forget about it, I'm sorry. No, just be very sincere, open up about what happened once you're ready, so you can both process it together and have, again, a plan to either prevent it or a plan to know what to do if it happens again, to deal with it in a better way. So don't be afraid of that. This also helps to keep a relationship, to repair a relationship with something negative happened. And the last tip, and I think it's one of the most important, is remember to smile. Remember to smile to each other. Smiling produces a lot of good feelings, and you don't need a reason just to you don't need to hear a joke then to smile or to laugh. No, you're going about your day normally, and just try to give a nice, comforting look to each other with a smile. And it helps a lot to the other person who's receiving that smile to feel better. Maybe if they're not doing well, that smile can brighten their day. So, and this is something my husband likes to do. It was something that he was doing by himself when we weren't together yet, where he'll just smile in front of a mirror, because he knew that could, that action on his body of smiling will give a message to his brain that to feel better, to feel happier in a situation where maybe he's not doing too well. So he kept practicing that once we were living together here in Canada. He sometimes just I'm going in and out of the room, maybe bringing him something, and he'll just look at me with a beautiful smile, and I just smile back, and it really brightens your day. It really keeps maintaining that positive atmosphere between each other. And please also do fun things together. Do fun things together, adapt them to each other's situation, right? Like there are many ways to adapt games or fun activities. It may take some patience and effort and some research, but there are things you can still do together, fun things. Everything in the relationship doesn't have to be so serious, or we're just dealing with the day-to-day challenges of GNE myopathy and we can have fun. No, fun must be a part of your relationship. Like I remember, some time ago, me and my husband, we bought a Monopoly board, and it was a very fun experience. There's an app where you can replace the dice if you cannot shake the dice anymore by yourself. So he will use an app. He just has to press the app on the phone, and it shows the number of steps he has to give in the board. And it was a very fun experience because it was a side of him I never seen, where he's very competitive when it comes to games in general. So it was very fun to see that side of him being very competitive. He really wanted to win the Monopoly game, and we played it 3 or 4 times before we would stop, because he just kept winning and winning and winning. And one time he let me win. So that was very a very fun experience to share together. Also, of course, there are other things you can do together, like traveling. We have traveled a couple of times to visit my relatives and do things with them. It has been very fun, very relaxing too, to get out of your usual environment and just to be in a new place with more loved ones, when you visit family, and see new places. All that like also promotes good feelings in the relationship. And so what I'm saying here is like, whatever you can do to have still fun together, do it. Not everything has to be like, oh, we're living with this disease that keeps progressing, what we're gonna do. No, make time for fun. It will nurture your relationship, and it will make things more manageable to cope with. And now I want to leave you with some additional resources. I put here at the end of the slides that will be available to you eventually, 3 exercises that you can practice to strengthen your relationship. These exercises come from the Gottman Institute. They come from couples therapy, but they can be applied to any context, to any type of relationship. You just have to slightly adapt them, perhaps, but they're very good to apply, whether it's between parents and their children, or siblings, or friends, or even in workplace. You know, the first exercise I appreciate, which is an exercise that helps you to choose from a list of characteristics, like things that you see in each other that are positive, and to let the other person know. The next exercise is soften startup, which is the communication exercise that we saw in the previous slides about when I feel I need. And the last exercise that I put there is called aftermath of a fight or regrettable incident. Is to process, you know, after you have a disagreement, or you hurt each other by saying certain things or by not doing certain things. You know, once you're both ready to talk about it and to understand what happened, what went wrong, this is a very good exercise for that, and to, you know, repair the relationship, and to create a plan to avoid something like this from happening again, or to do something about it when it happens again. I'm also including slides for about tips for caregivers or care partners, as well as self-care tips. It is very important, even if you're just a patient, to learn about this, because, as I said earlier, when you're a caregiver or a care partner, you're caring for somebody else, and you're sometimes too tired, or you don't make yourself a priority too. And the truth is, like, the caregiver also needs to take care of themselves in order to do what they're doing in a way that is not causing like caregiver burnout. So all these tips that you're seeing here for you, the caregiver care partner, are very important to know. Like, if you see your caregiver care partner is, you know, it's getting close to being like having caregiver burnout symptoms, just suggest them to do some of these things, you know, to take some time for themselves, to practice self-care. Like, I didn't know about self-care for so many years. It was just a few years ago when I found the NDF, and I was able to talk to Carol and to a few other caregivers. Like, then I was informed about the importance of self-care, and, you know, to make time for myself, to make also myself a priority. And that really, it has changed my life. I can tell you that much. My life has changed a lot in the last year since I was able to learn about self-care. And I do appreciate that the NDF has somebody like Carol in the Emotional Wellness Clinic, which is, you know, a person you can talk to, and, you know, that can listen, and, you know, has been very encouraging for me to be where I am right now as a caregiver, you know, also making sure I care for myself, and I don't put my needs to the side anymore because of feeling tired, or because thinking that, you know, I just can't do it. You know, it's like, it has really changed my perspective as a caregiver for my husband. And obviously, because I'm much happier, because I also take care of myself, my husband feels happier too, seeing me happier, and the way I care for him is much more positive. So it's very important to learn about this, and to let your caregiver or care partner know to practice this before they get into a burnout situation. So I'm also leaving you the link for the NDF Emotional Wellness Clinic if you need to talk to Carol, whether you're a patient or caregiver. And also, please do encourage the caregivers and care partners to join the caregivers group. I would like to see the group to become more active, for caregivers and care partners to share more about their experiences, and to support each other. It's very important, and I hope you can let them know about it, so it can become a much more active group that can support each other in this situation. And I'm also leaving you with a slide about coping tips, that this has helped me and my husband to cope better with GNE myopathy. And these things that caregivers, care partners, and patients, I think, will benefit from. So check some of those tips, and if you see they're beneficial for you to cope better with GNE myopathy, practice them, because as we know, we're still looking for a cure for this disease. And while we are waiting for a cure, doing things that can help us to cope better with this, it will really be very beneficial to manage things in a better way. And I'm going to end with this phrase: kindness can transform someone's dark moment with a blaze of light. You will never know how much caring matters. Make a difference for another today. And I think that summarizes the whole presentation. Like, as I say, from both sides, as a caregiver and care partner and the patient, they can both show kindness to each other and care for each other in the ways that they are able to do it. So yeah, that's my presentation. And I like to open a discussion maybe with some of these questions. And if you have any questions, I'm more than happy to answer. And thank you for your attention and your time. Yeah, that's my presentation.
Well, thank you, Liseth. This was super informative and insightful. And I think it would be nice if people can kind of reflect on these questions. And if anybody wants to share a little bit about, what they do to nurture their relationship. And also, I know we're looking at these questions, so feel free to comment on any of these. And by the way, Tara, you can stop this part of the presentation after I ask the questions if people start to share information. But, when you're looking at these questions, thinking about your relationship, maybe think about what all the things that Liseth presented on. What would you like to apply to your relationship moving forward? There were so many tips and insightful thoughts and comments and advice and direction. So I think it would be really helpful for people to self-reflect and to think about what is their intention and what are they going to take away from this presentation and apply to their relationship. So anybody want to kind of share a little bit, feel free. We'd love to have a little bit of a discussion before we wrap up.